Hi everyone, welcome. Thank you for viewing our presentation. We are going to be presenting on the management of ADHD in pediatrics for this year's student health fair. Presenters are going to be Makayla Arriaga and myself, Daniela Barisano. So first we're going to talk about an introduction to what ADHD is. So ADHD is attention deficit hyperactivity disorder, and it's a disorder with symptoms of impulsivity, hyperactivity, and/or inattention. ADHD often manifests in childhood, and the symptoms affect behavioral, emotional, cognitive, academic, and social functioning. Hyperactive and impulsive symptoms typically are observed by the time the child reaches 4 years of age and increase during the next 3 to 4 years, peaking in severity when the child is of 7 to 8 years of age. And the symptoms of inattention typically are not apparent until the child is 8 to 9 years of age, and this delay might relate to reduced sensitivity of assessment of attention problems or increased variability in the normal development of cognitive skills. Problems with inattention may limit opportunities to acquire social skills or to attend social cues necessary for effective social interaction, making it difficult to form friendships. Hyperactive and impulsive behaviors may result in peer rejection, and the negative consequences of impaired social function may be long-standing. So this is a graph from the CDC that represents the estimated number of children who have ever been diagnosed with ADHD in the United States. As of 2016, 6.1 million, which is 9.4% of children, have ever been diagnosed with ADHD. 388,000 of those children were 2 to 5 years old, 2.4 million children were 6 to 11 years old, and 3.3 million children were 12 to 17 years old. Boys are more likely to be diagnosed with ADHD than girls, and the data shows that 12.9% of boys were diagnosed with ADHD versus 5.6% of girls as of 2016. So many children with ADHD also have other disorders. This graph from the CDC shows the percentage of children who are diagnosed with ADHD that also have another disorder. The majority of children with ADHD also have any mental, emotional, or behavioral disorder of about 64%. 52% of children with ADHD also have a behavioral or conduct problem. 33% of children with ADHD also have anxiety. 14% also have autism spectrum disorder, and 1% have Tourette syndrome. About 3 in 4 children with current diagnosed ADHD receive treatment, whether it's medication or behavioral treatment. In a 2016 National Parent Survey, they reported that 62% of children diagnosed with ADHD were taking ADHD medication. 18% of those children were 2 to 5 years old, 69% of those children were 6 to 11 years old, and 62% of those children were 12 to 17 years old. 47% of children diagnosed with ADHD received behavioral treatment. 60% of those children were 2 to 5 years old, 51% of those children were 6 to 11 years old, and 42% of those children were 12 to 17. Together, the majority of children diagnosed with ADHD, which is 77%, were receiving some sort of treatment. The majority of those children, 32%, received both medication and behavioral treatment, followed closely by medication alone at 30% and the behavioral treatment alone at 15%. And 23% of children diagnosed with ADHD did not receive medication nor behavioral treatment. So the etiology of ADHD is due to a variety of factors, including both an environmental and a genetic component. It's one of the most heritable psychiatric disorders. Potential environmental associations include viral infections, nutritional deficiency, smoking during pregnancy, and alcohol exposure during fetal development. So there are three main clinical features of ADHD. And they include inattention, impaired functioning, and the core symptoms of hyperactivity and impulsivity. Inattention is reduced ability to focus attention and reduced speed of cognitive processing and responding, which is called a sluggish cognitive tempo. Failure to provide close attention to detail, seeming to not listen, failing to follow through, easily distracted by irrelevant stimuli, forgetfulness in routine activities, difficulty organizing tasks, and avoiding tasks that require consistent mental effort all fall under the inattention. Impaired functioning has to do with the main symptoms of ADHD that impair a child's function in social, occupational, and academic activities. Problems with inattention may decrease opportunities to acquire social skills and social cues needed for effective social interaction. And finally, the core symptoms of hyperactivity and impulsivity is excessive fidgetness, difficulty remaining seated, difficulty playing quietly, feelings of restlessness, excessive talking, difficulty waiting turns, blurting out answers too quickly, interruption or intrusion of others, and difficulty to keep up with that child.
Hi, my name is Makayla, and I'm going to start off by talking about some non-pharmacological treatments for children with ADHD, and this is a health intervention that does not involve medication. So many parents may not want to start their kids on ADHD medications right away, so instead they may try some of these options instead. Also, guidelines recommend trying non-pharmacological treatment first, but a mix of non-pharmacologic and pharmacologic interventions work best. So, exercise and diets. So, studies have shown that even a half hour a day of exercise and being outside can help decrease the severity of ADHD symptoms and help children focus better. So, have them pick an activity that they like to do and have them lead it. Also, a balanced nutrition and diet can help as well. So make sure the child eats foods that are good for the brain, such as foods with high amount of protein, such as beans, nuts, and cheeses, foods with complex carbohydrates, such as veggies and fruits, and lastly, foods with omega-3 fatty acids, such as fish. So also cutting out preservative and food colorants can help decrease ADHD symptoms as well. Add in vitamins, minerals, and nutrients, and eliminate foods that actually can trigger a child's symptoms. So now we are going to be talking about behavioral therapy. So parent focus interventions. So actually, according to the CDC, only therapy that focuses on training parents is recommended for young children with ADHD because young children are not mature enough to change their own behavior without their parents' help. So we also have child focus interventions, which include cognitive behavioral therapy. This actually is going to help the child with their thought process and teach them how to look at things from a different perspective and to help them learn how to stay focused. Lastly, we have school focus intervention. So classroom-driven goals can actually help with the demands a child with ADHD may be struggling with, and a child can also be on a individualized education plan known as an IEP for school. So here are them strategies to help students in the classroom with ADHD. So a teacher could set up a personal workstation in each class for the child, have daily check-ins with the student, allow extra time for work to be completed if needed, make sure to give all clear instructions in all formats, involve student in the lesson being presented, and lastly, make sure there are plenty of opportunities for extra movement within the classroom. So now we are going to be talking about pharmacological treatment, and we are going to start off with stimulants. So with this medication, there's actually many different types in different formulations. So there's actually pills, there's some liquid, and there's even a patch that can be tried as well. So these are known as methylphenidate, which is Ritalin, Focalin, and Daytrana, and amphetamine, which is Adderall, Vyvanse, and Procentra. So there is a black box warning on this medication for abuse, dependence, and cardiovascular events, but it is important to talk to your pharmacist about medication safety and to know what signs to look for abuse. So some side effects are dry mouth, decreased appetite. This mainly affects lunch, so make sure that the child has a nutritious breakfast and dinner. Insomnia, so you could try giving the dose earlier to the child. have a decrease in the dose, or you can even switch a child from a extended release version to a immediate release version of the medication. Stomach upset, you can have the child take the medication with food, headaches, and irritability. So the child should be monitored monthly until their symptoms are stable. It is important to know that there are some potential for drug interactions, such as other stimulants, which is also caffeine, and it can also decrease the efficacy of blood pressure medications. Lastly, there is a warning for a lower seizure threshold. It can cause some motor and verbal tics of a child. It can increase their blood pressure and heart rate, and it could actually even have a new onset of psychosis or mania. So now we're going to talk about some non-stimulants. So we have atomoxetine, which is known as Strattera. There is a black box warning on this medication for suicidal ideation in children and adolescents. This is nothing that you need to be worried about, but it is important that all parents or caregivers for the child knows about this and what symptoms or signs to look for. So some side effects are increased sweating, drowsiness, dry mouth. This medication does have a delayed onset compared to stimulants, and they should not be opened, crushed, or chewed. Now we also have clonidine, which is Catapres or Capve, which is approved for high blood pressure, so we would need to monitor their heart rate and blood pressure at every visit. Some side effects are some low blood pressure is actually important to look out for with the first dose, but over time this can go away. Abdominal pain and dizziness, and a child taking ADHD medication should not stop taking them unless told by their doctor. So your local pharmacist is there to help. So we are a strong resource after the diagnosis is made. We are there to provide support. In most cases, we are one of the first people to know about their diagnosis of ADHD. So it is important that they know that we are there for them. We can provide resources, as there could be a strong stigma with ADHD, but it is important for children to know that there are other children with this as well. We help patients understand their condition better, so we can teach them about ADHD, and we can actually explain to them that these medications are going to make their life easier. We can give drug information regarding prescription medications, such as how to take this medication, when to take it, and what to look out for. We can also make some OTC medication recommendations if needed. And lastly, we are there to optimize treatment by making adjustments over time. So as a patient gets older, maybe this drug does not work for them anymore, or they need their dose increased. So we are there to help make those recommendations when needed. Here are the resources that we use throughout our presentation, and Daniela and I just want to say thank you for taking time out of your day and watching our short presentation on ADHD management within children. Thank you.